Welcome back. For many folks, Obamacare has become a punching bag for everything wrong with the healthcare system. But did you know Obamacare only accounts for healthcare coverage to 10 million Americans, while 151 million Americans get their health insurance through their employers? While increases in premiums and copays are going up in employer-based plans too, they're not going up as much as they are under the Affordable Care Act. Still, it amounts to pay cuts for millions of Americans every year as workers pay an increasing burden of their health care costs. And joining us for more is Dr. Sarah Cloud from State College of Florida, Michael Snipes, an economics instructor at USF Sarasota Manatee, Keith Fitzgerald, a political science professor at New College, and J.S. Gagnon, CEO of ClickMyQuote.com. We have a great panel here tonight because we've been reporting so much about the cost of Obamacare. We have been underreporting, I believe, what is affecting most Americans, which is our premiums in our employer-based systems, and the out-of-pocket costs go up every single year. And the question is why? And Doctor, let's start with you.
Well, our healthcare expenditures really are a combination of what our expenses are at hospitals, our doctors' offices, pharmaceuticals, and other types of healthcare services. Hospitals are pretty much the share of that. About 50% of healthcare expenditures come from hospitals. The cost of care increases for a variety of reasons. It's a pretty complex formula of why some of those costs increase. But the insurance companies is really looking at pooling the risk, making sure that within their membership that they can collect as much of the premiums as needed that they can pay out for those services across that membership. And it's always a risk for them. They always have to look at how much do they need in order to be able to pay out those healthcare services.
Now, there are a number of drivers, as you say. It is our general health, our population, which is getting older, but there are also the costs of hospitalization. Keith, this is something that you have been concerned about for a great many years. Why has it become so difficult politically to fix this legislatively?
I think that what our political system is worst at is allocating pain. So underneath the payment scheme, there are these costs. In the United States, costs are higher than they are in any other country. And part of the reason is we pay physicians more, we pay more for pharmaceuticals, we pay more for hospitalization. Some of that is reaped as benefits to certain people. People provide the services. The political system, if it went about trying to address directly those payments, would be saying to somebody, you're not getting as much money as you were before. If you think about the Affordable Care Act, it said we will cover the payments through insurance, but it really didn't do enough to address the drivers underneath it.
JS, when you are dealing with both families and companies and so forth, are they able to make the distinction between the problems that we're seeing with the Affordable Care Act and in the private insurance market and employer-based systems?
A lot of times no, just because it's very confusing. People just don't know. And there's a lot of issues with the healthcare system, and the individual, the healthcare.gov exchange is a completely different market than the group exchange, or the group market. So there's really, what we see right now in the state of Florida this year and in the previous years, the trend is between 11 and 13% in rate increases every single year. So if you're an employer, that's a lot.
And Michael, is there some way to talk about what kind of bite, as a matter of percentage of people's income, this takes out from them, just dealing with employer-based insurance from year to year to year?
Sure, and I think that's something that you definitely need to have some sort of context in a macroeconomic sense what's happening. For most people, healthcare costs are a very significant portion of their income. And when you combine that with things that are happening in the economy as a whole, more specifically kind of stagnant wages not increasing, if we've got something that is a big portion of spending for most people and that cost is going up and up and up, but there's not a corresponding increase in income, that's going to put a big bite in people.
And that's why, folks, the middle class is falling behind. We are just getting warmed up. We'll have much more on the rising cost of health care right after the break. Stay with us.
Attention type 2 diabetics. The FDA warns of an increased risk of amputation associated with certain diabetes medications. If you took the diabetes medications Invokana or Invokamet and then suffered an amputation or one of these other serious injuries, call the Rely On Group right now. If you've suffered amputation or any of these injuries after taking your diabetes medication, call the Rely On Group today. You may be entitled to substantial financial compensation. The FDA has recently warned about an increased risk of leg and foot amputations associated with the use of certain diabetic medications such as Invokana and Invokamet. If you or a loved one took the diabetes medications Invokana or Invokamet and then suffered an amputation, ketoacidosis, kidney failure, or even death, call the Rely On Group now. We are here to help you get the justice you deserve. You may be entitled to substantial financial compensation. Call 800-355-8205. That's 800-355-8205.
You love your couch and want to protect it from spills, food, and scratching, shedding pets. Introducing Couch Coat, the reversible, washable quilted cover that protects your couch. Shield against spills, wow, stop stains, and dirty pet paws and sharp claws. Plus, it's reversible with 2 stylish colors. Guaranteed to fit any couch up to 92 inches or your money back. It even has covers to protect armrests. Machine washable too.
My grandkids destroy everything, but with Couch Coat, my couch is always protected, looking as good as it did the day I bought it.
Get your Couch Coat for just $19.99, and it's reversible in brown and cream, like 2 couch coats for the price of 1. Order right now, and you can double your offer. Get a second Couch Coat. Just pay a separate fee. Order right now.
Call 1-800-943-0710 to get your couch coat. Call now or go to couchcoat.com. So call 1-800-943-0710. That's 1-800-943-0710. Call now.
Christmas Traditions by LuxArt Silks, where more is merrier. Make your holidays sparkle with style. Browse our amazing showroom, cute collectible cottages, and beautiful Christmas displays. Find the inspiration, selection, and quality you need to deck the halls merry and bright. Christmas Traditions also features the area's largest selection of quality pre-lit Christmas trees, every size, shape, and color, and plenty of decorations to make your home shine for the holidays. Christmas Traditions by LuxArt Silks, where more is merrier. Visit us on New 301, just a quarter-mile north of University Parkway.
Welcome back. We're talking about the rising costs of healthcare. Joining us for more is Dr. Sarah Cloud from State College of Florida, Michael Snipes, an economics instructor at USF Sarasota Manatee, Keith Fitzgerald, a political science professor at New College, and J.S. Gagnon, CEO of ClickMyQuote.com. And Michael, I'm going to start with you because there was an incredible quote from the chief executive at the Kaiser Family Foundation. Healthcare's greatest mystery, why healthcare insurance costs have continued their slow increase even as the economy has picked up in the last few years. We can't explain it.
Well, one of the things that we've mentioned already is risk plays a huge factor in determining exactly how much people are going to pay. If there's uncertainty as to how much revenue insurance companies are going to be getting because the plans are always changing, well, we have to compensate for that risk. Right, insurance companies are going to charge employers, they're going to charge the people who own these policies, they're going to charge them more because if there is in fact uncertainty as to how much revenue they're going to get in the future, they're going to front load that and they're going to get that money now and increase prices now because of the uncertainty.
JS, there's no doubt the cost of providing health care to your employees is going up and companies are paying more, but in many cases the companies are at least passing along some of those costs to their employees.
Mm-hmm. Absolutely. I mean, what I see, and in my opinion, one of the biggest reasons for these increases every year is the healthcare industry is the only industry in the entire country where there's no price transparency. We go to the doctor, what do? We pay a copay. We get a prescription, what do? We pay a copay. We don't know what things actually cost. Economically speaking, that causes a large amount of inflation.
And Dr. Cloud, I was mentioning to you earlier, we had a situation in my own family where my kid got sick overnight in the hospital, had to be admitted. The bill to me was about $400, but the actual cost was $14,000, and I was wondering, where did all that money go?
And that's a very good question. And even if you get an itemized bill from the hospital, you might find, like you mentioned, that there might even be inconsistencies, that if you got a similar bill for the exact same services from Miami, it might be a completely different cost. It may be a different cost for the person in the bed next to you because they had a different insurance plan that had a different negotiated price. it's very difficult to really sort that all out because we really don't have a clean, transparent place.
And Keith, when you're talking about the politics of this, those people who did not like Obamacare from the get-go are using people's anger, even if they have employer-based insurance, to basically gin up the outrage about the rise in healthcare costs.
Right, and I think it's really important for people to remember that prior to Obamacare, cost inflation in healthcare was astronomical. It was going up much faster than the underlying rate of inflation. So this is not a problem that was created by Obamacare. It's not a problem that Obamacare solved. If you did away with Obamacare or did single payer, we still have significant cost inflation in healthcare, and that has to be directly addressed through policy, not simply through figuring out who pays.
So where are we at in terms of our government taking this on? They've not been able to repeal and replace Obamacare. You've seen what the president did today. Is there any discussion you see either at the state or federal level in terms of getting costs under control?
Well, you know, there have been some experiments at the state level, so there might be a little glimmer of hope there. They haven't worked great, but Maryland has an interesting system. But really, I think this points to a fundamental flaw in our whole political system. Interest groups are so powerful in blocking changes that they don't like and taking care of their immediate self-interest that sometimes the general interest of the public simply can't be addressed. And that's not a problem of either of the parties. It's a problem of both of the parties and the whole way the system works. So we really have to start thinking about fundamental change in our attitude toward politics.
And you tell me who wants to take this on, but this Kaiser family survey showed that although that it has remained fairly stable, 53% of companies offering their employees health insurance, the numbers have fallen over the past 2 decades. So fewer and fewer companies are even offering this kind of benefit to employees, and I can imagine that in the years to come, this is, unless we get this under control, we're going to if we think our problem is big now, it's about to get worse.
Yeah, and I think a large part of that is they're going to view it as a cost-saving measure. If healthcare is going to be something that is so expensive to provide, then employers may simply choose to go another route, may not choose to buy it because it is so expensive.
You know, Doctor, when you look at what are the exact drivers of, at least in our area, of the increasing cost of healthcare?
I think some of the drivers are very global, including just our aging population. We had this big swell of population called the baby boomers that are now turning 65, and pretty soon they'll be 75 and so on. And with that age and advancing age, we have increased chronic diseases. I think that if we look at our population health in general, that we really are experiencing tremendous increases in chronic disease. I think that as healthy as we can be will decrease our need for health care. That we're seeing increased costs because we're sicker. We're older, there's a larger older population, and we're sicker. Increased rates of diabetes, increased depression, increased other chronic diseases. We still have 24% of our county adults that are smoking. You know,
especially
so these are some of the things that are contributing to our demand for health care.
All right, we have much more to talk about on the cost of health care. We'll be right back.
Attention, Americans eligible for Medicare. Are you getting all the benefits you're entitled to? Did you know there may be money available to lower your medical prescription costs? Call Health Markets and we'll tell you if you qualify.
Hi, I'm Dr. Martin Jeetzy. It's a new Medicare year. That means more changes and more confusion. The key question is, what can you do now to ensure you get the care you need in the coming year?
Call Health Markets today. You may qualify to save money on prescriptions. We'll help you find plans that may cost less, cover more, and could even lower your prescription costs to increase your savings. We help you find all the benefits you're entitled to, and we do it at no cost.
Make sure you have what you need to get the care that's right for you.
Find out if you qualify to receive extra help with your prescriptions. Call the number on the screen now. Representatives are standing by.
This is an important announcement. If you're between 50 and 85 and worried about your loved ones, you can still get affordable life insurance for peace of mind.
My life insurance coverage is guaranteed, and I was not required to get a medical exam.
I had high blood pressure and diabetes, and I got my coverage with one telephone call. No exam necessary.
I'm a smoker, and I wanted to take care of my family. I called to get my life insurance and my affairs in order. I wanted to do the right thing.
Call Final Expense No Exam Insurance. Your rates are guaranteed and will never increase.
I called and learned that this insurance cannot be canceled even if you get sick or gain weight.
And there are no restrictions on how my beneficiaries use the money when I'm gone.
Approval was easy and the price was right. I wanted to do this for my children.
Call 800-738-9812. 800-738-9812.
Are you a soccer mom or dad? Regardless of their age or experience level, when your kids play soccer or any other sport, there's one person on the sideline who is key to help recognize and seek medical care for sports-related concussion. It's you. You need to know the signs and symptoms of concussion, and you need to act if you think your child has been injured. Remember, when in doubt, sit them out. To learn more, go to cdc.gov/concussion. 1001, 1002, 1003, 1004.
Welcome back. We're talking about the increases in healthcare costs, and joining us for more is Dr. Sarah Cloud from State College of Florida, Michael Snipes, an economics instructor at USF Sarasota Manatee, Keith Fitzgerald, a political science professor at New College, and J.S. Gagnon, CEO of ClickMyQuote.com. And J.S., let me start with you. For those people in our area who have employee-based insurance, what are you seeing right now in terms of their increasing costs over the next year or two?
I think unfortunately it's going to continue to increase. Deductibles are going to continue to increase. What we're seeing a lot of people do is take the higher deductibles, basically buy down to save money on premiums, especially for families. It can save $300 or $400 a month in premiums. By doing that, yes, you're getting a higher deductible, but we're seeing a lot of new plans coming into the market. You know, supplemental plans, critical illness plans, accident plans, gap insurance plans that they can use to cover those deductibles. Unfortunately, the state of the market has kind of forced us in that position, and that's the only way we can keep it affordable.
Keith, it almost seems like we are at a time of incredible chaos because the president took this action today, the repercussions of which we have no idea. Congress does not know what it's doing. You had the Speaker of the House saying this afternoon legislation is probably still the best way to go.
Well, you know, our political system is broken. It's just not functioning very well. And again, I emphasize you can blame it all on the Republicans because they control everything. But it's really across state and national level. It's across parties. We're just not getting things done. And I think not just insurance companies, but all businesses worry about uncertainty. Uncertainty makes it very difficult to invest. So there's going to come a point where this is going to start coming due. You know, what the political system needs to do as much as anything is come up with reliable policies that people can count on so they understand what the cost structures are.
And Michael, this is taking a bigger and bigger bite out of the incomes of many of the folks who are watching this right now. At what point does the bite overwhelm people's abilities to pay for all their mortgages and everything else that they need to pay?
Well, I think we're already seeing some of those effects. I mean, bankruptcy, or one of the primary drivers of bankruptcy are healthcare costs. And so we're already seeing some of those effects. And if we see the trends continue, you know, with stagnant wages and increasing healthcare costs, that's something that's just going to get worse and worse and worse.
And Dr. Cloud, in terms of, you know, you're in the educational system and the medical system, you know, is there a growing view in terms of amongst your professionals in terms of what is the best way to attack the lowering of the cost of medical care and other things that would eventually drive down the cost of insurance?
Some of the changes that we've seen in healthcare reimbursement, for example, in the hospitals, which was part of the Affordable Care Act, is a shift from fee-for-service to where we would just pay for the services no matter what, to a value-based purchasing system.
Meaning what?
Meaning that for the reimbursement for Medicare, that still a large proportion of that funding is still fee-for-service. But CMS, or the Centers for Medicare and Medicaid Services, has pulled back a small percentage of that and then had the hospitals to report things like patient experience. Medicare recipients will receive a survey called an HCAP survey that assesses how well was their experience in the hospital, how well were procedures explained to them, their medications explained to them, how well was their pain controlled, how conducive was the environment to their healing. They also monitor a number of complications that can occur in the hospital. And so that value, then if they achieve those goals, then part of that reimbursement's tied to that value. And I think we're seeing more and more of that.
Keith, we have only a couple of seconds left. The approach that we seem to be getting out of Washington now is block grants to states to kind of do your own thing. So if that is the case, is it less likely we're going to get, you know, kind of a national way of dealing with a national problem?
Well, there's a reason why we have federal funding of these programs, and that is because the tax base of states is insufficient to meet the needs of the citizens of those states, so the federal government has to come in. So if those block grants did not keep up with the rate of inflation in healthcare, people would just go without, and that's not a good deal. So I'm skeptical of that approach.
Okay. We have to take a quick break, and we'll be back in just a moment.
If you're only hungry for a slice of apple pie, why buy the whole pie? And you certainly wouldn't want to pay for an all-you-can-eat buffet. So if you don't use your cell phone that much, why get charged for a plan that's too big, or even an unlimited plan? Luckily, there's still a wireless company that shares your values. Welcome to Consumer Cellular. Our average customer pays about $25 a month for everything they need. Many pay even less, as plans start at just $15 a month. You'll get a straightforward bill that's easy to understand with no surprises and all the attention you deserve from our friendly customer service team. No wonder Consumer Cellular has received the J.D. Power Award for highest customer service 3 times in a row. Plus, if you're an AARP member, you'll receive special discounts. It's easy to switch. You can even keep your phone and your number. So stop paying for more than you need and start your 30-day risk-free trial today. Call 800-457-2317. Go online or visit a Target store today.
Glasses and contacts. You need them to see, but they put such a strain on your life, you miss precious moments. Due to new advances in vision improvement technology, LASIK is now affordable for almost everyone, with procedures starting as low as $299 per eye and over 1 million procedures performed by our trusted independent surgeons. LASIK surgery is a sensible, safe, and affordable solution to improve your vision. Our simple 3-step process begins with a free evaluation, followed by an extensive preoperative exam to determine if you're a candidate for LASIK eye surgery. Depending on the results of your evaluation and eye exam, you and your surgeon will choose the LASIK option that works best for you. So call now to talk to a LASIK Vision Institute counselor and schedule your free evaluation. That's a $100 value, free. Call the LASIK Vision Institute for your free evaluation and enjoy more of your life.
Call 1-800-813-0109. 1-800-813-0109.
Enjoy some of the best Suncoast restaurants on me. Just go to mysuncoast.com/dining, sign up for the newsletter if you haven't already, and you can win a $50 gift card to a restaurant in our area. We'll pick a winner each week, so go on our website and sign up now.
And our guests join us right now for final thoughts. And JS, we are in the season of open enrollment, and people are going to get sticker shock, whether they are in the employer-based market or on Obamacare. What are you telling them?
Well, I've probably gotten about 30 or 40 emails or texts today of people panicking about the rate increases that they're seeing. And at this point, I'm telling them, listen, you know, November 1st is the start of open enrollment. You know, whether you're on the Affordable Care Act through Obamacare or an employer, a lot of employers renew on January 1st. So, you know, we've got some time. We've got some time to strategize. We've got time to look at all the options. At the end of the day, it's wrong. It's hard to tell my clients that they could be facing a $2,000 a month premium. It's not right. And we need to help them. We need to educate them. And we need to, you know, make sure that we provide them with everything, all the resources they need to make the best decisions for their families.
And Keith, do you have any hope that the Senate or there's any bipartisan effort going on? I know there is, that it will get anywhere.
Well, I think there may be some hope that there would be bipartisan agreement on some of the stopgap measures to shore up the insurance market. But as far as the big picture, I don't see it happening. And one of the things people should think about is that if you're concerned about the possibility of single payer, if you think that's a bad idea, the longer we don't respond to these cost drivers and this whole mess, the more people are going to be pushing for that as a solution, because it's simple, it's straightforward, and people understand it.
And Michael, what are the consequences to the U.S. economy if we don't figure this out?
Sure. I think if we see a lot of the trends continue the way they are, and if none of the issues really get addressed in a meaningful way, healthcare is such a huge part of the economy that it could put a big enough strain on the economy as a whole that we might see recessions occurring, we might see depressions occurring.
And Dr. Klatt, what impact does this have on medical professionals like nurses and doctors in terms of their ability to make a living in this system now and in the future?
I think that's a very good question, and I think particularly for nurses and other health professionals that are mid-level and front line, they also have to pay insurance. They have to also pay the premiums for themselves and for their families. And it'll make it difficult for us to recruit those professionals for our community, which would further impact our population's health.
Okay, we have to wrap it there, but before we go, we want to share with you some thoughts about last night's topic, the disease killing palm trees in the Sunshine State. The disease is called the Texas Phoenix Palm Decline. It was first identified in trees in Sarasota and Tampa in 2006. The disease spreads naturally to trees by sap-feeding insects like plant hoppers. If trees show a majority of discolored or dead leaves because of the disease, they need to be removed to prevent spreading. Landscapers can protect these trees with antibiotic injections, but the price can be as much as $800. Now let's hear from some of you on what you thought of this topic. Mary says, I love the palms when I come to Florida every year. Would hate to see them all die. Treat them to save them. Christina says, save them. Everyone should be responsible for the trees unless it's city property. And Jana says, when you think of Florida, you think of sandy beaches and palm trees. So yes, they should absolutely try and save as many as possible. It's part of Florida's identity. Well, if you'd like to join the conversation about tonight's topic, just visit our Facebook page at facebook.com/mysuncoast.com.abc7. And FYI, you can watch past discussions. They're on demand. They're available on Apple TV, Amazon Fire, and Roku. And we want to stay up to date on our local news. We're proud to announce our new ABC7 My Suncoast News app. If you have an iPhone or an iPad and you currently have our news app, you'll want to go to the App Store now and download WWSB ABC7 Tampa My Suncoast. It's free and it provides the most comprehensive news coverage for Sarasota, Manatee, Charlotte, Hardee, and DeSoto counties. If you're an Android user, don't worry, no problems. You'll get the new version automatically. We want to thank our guest tonight, Dr. Sarah Cloud from State College of Florida, Michael Snipes, an economics instructor at USF Sarasota Manatee, Keith Fitzgerald, a political science professor at New College, and J.S. Gagnon, CEO of ClickMyQuote.com.